Well, tonight we are looking back at a year that tested healthcare professionals in the Crosse region like none other, and we spoke to leaders at 3 area healthcare systems who had to rethink how to care for their patients. News 8 Now's Jordan Fremstead shares their experiences and what 2020 taught healthcare workers in western Wisconsin.
Yeah, good evening, Martha. Obviously, 2 minutes won't do it justice to everything frontline healthcare workers learned in 2020. However, officials in our community agree that communication and collaboration were the only ways to overcome fear of the unknown.
What he heard said.
You don't need an explanation of 2020.
I sent a note to a colleague and I said, we didn't see this coming, did we?
This is a conversation of 3 Coulee region healthcare systems about the lessons taught by the pandemic. Tomah Health Chief Nursing Officer Tracy Myrie says organization is vital.
Well, I think the importance of planning is something that has really kind of came to the top of the chain this year.
Tomah Health lacks a critical care unit for severely sick patients. Tomah Health staff worked with La Crosse healthcare systems that have ICUs.
We really worked as a region to make sure that we determine, what types of patients should stay here and what types of patients do we need to send there.
Gunderson's Dr. Michael Dolan says things can change fast, like the surge in daily hospitalizations this fall.
We had to take entire wings and units offline and kind of create miniature ICUs in those units to be able to provide the care to those patients.
Staff at all healthcare systems experienced the pressure COVID-19 pressed on their workflow. Mayo Clinic Health System's Dr. Paul Mueller says they were able to move people around to relieve that pressure.
Keeping up to date in skill sets or being flexible, and that's an expectation of being part of organizations, is one approach to doing that.
He says a person's ability to adapt to multiple environments is a skill students in healthcare should learn for future jobs.
That was a better situation to be in rather than only with staff who had a confined set of skills and couldn't be flexible in where they worked.
The popular consensus from our conversation revolves around consistent, clear messaging, something Dolan says can be better.
Too many people felt that this was a 2 to 3 month blip on the radar screen and then they would be able to get back to their normal life. And really, I think from the beginning, most of us knew that we would be dealing with this for 1 to 2 years.
The pandemic also refreshed these frontline workers' memory. There isn't a better career calling in the world for them.
I really do love it. I think we do make a difference. That's why I wanted to be a nurse.
In La Crosse, this is Jordan Fremstead, News 8 Now. Now, telehealth and virtual medicine is something healthcare leaders say is here to stay. Mayo Clinic Health System pre-pandemic actually planned to contribute more resources to that, and then the pandemic hit, and they had to move those plans up into place sooner. They say patients who use it love the convenience and the appointments from the comfort of home.
All right, thanks so much, Jordan. Healthcare leaders also say the community can learn from this year as well. The surge in cases and hospitalizations was largely due to people disregarding healthcare guidelines and gathering in large groups.